So today we are here. The Premier is here and the MECs, the MEC for Health as well as the MEC for Infrastructure Development. And of course, we have Professor Bruce Milado, a member of the Premier's COVID-19 Advisory Committee, who will start, and then we will then have the vaccination program, the update on the vaccination program, and we will also deal with some of the health response issues. As you know, the third wave is here, and we have to deal with that. So we will, in our presentations, also take you through what are the steps that we are taking to ensure that we manage to go through this third wave together safely. Without any further waste of time, I would like to invite Professor Bruce Milado to come and start the presentation, and then the next ones will follow.
How do we change the slides? How do we change the slides? Was I controlling from there? Okay. All right. Thank you very much, Premier, DG, MECs. I will be speaking on behalf of the Premier COVID-19 Advisory Committee, and I will give you an overview of all the numbers to date and analytics to date that speak to the fact that we are solidly in a third wave, in a third resurgence. What you see there in the upper graph is the number of daily occurrences, where you see the historical perspective of the first, second, and now third wave. We are technically in the middle of a resurgence. This is the 5th week of sustained growth in the number of cases. And as a matter of fact, in the past 2 days, we've had about 3,000 cases a day, which is already quite a big number. Now, these are daily occurrences. We can look at the lower graph, where we average over a week, and you can see in the past 4 weeks, we've seen the first week of the resurgence with a 63% increase with respect to the previous week, 57, 47, and 40%. That basically means that we have a sustained acceleration in the numbers. The numbers are going to become large, and we expect the numbers to keep growing all through June. Next, please. We have a different statistic here. We've got the number of officially deceased due to COVID-19. As you can see, the daily occurrences, you clearly see an increase in the number of people deceased as recorded to be due to COVID-19. That's the daily occurrences. You can look at the graph below. That is the weekly fatalities. When you integrate your sum over a week, you can see clearly that there is a continued growth in the number of fatalities. Let's go next. You can also look at the number of fatalities from a different standpoint. These numbers are reported by the MRC. This is what people refer to as the excess mortality in the province up until May 29th. What you can see there in the blue curve talks about the excess mortality, the total possible mortality with respect to previous years that continues to grow, and you can compare that with the red curve, which is the officially recorded COVID-19 mortalities, where you can see both are independent statistics that indicate growth in the number of fatalities in the province. Let's go next, please. This graph is a bit busy, but I'll walk you through it. These are the number of hospitalizations for different districts in weekly. What you can see there is now the number of hospitalizations has grown significantly. The last week, the downtick is not a real downtick. It has to do with the way statistics are collected. So we have basically sustained growth in the number of hospitalizations as well, which is an independent metric that speaks to the fact that we are in the middle of a resurgence. Can we go next? Another important independent metric is the positivity rate. You can see there the historical data. You see the second wave, the positivity rate goes down in the interim period between the second and the third wave. Now we are seeing that the number of positives are now growing. The positivity rate, or the fraction of people that test positive to all tests, has been growing steadily and has passed the 10% rate, which is a metric that speaks to the fact that we are also in the middle of a resurgence. Let's go next. Mobility is extremely important. Mobility is one of the drivers for the virus to move around in the province. You will see now in a few slides from now how the virus is spreading in different districts and sub-districts. And if you look at these graphs come from Google. Let's focus on the red one. You can clearly see that despite this minor uptick about a week ago, overall the mobility is very similar to the mobility we had right before the second wave, and it's been among the highest after the hard lockdown last year. So this basically means that mobility is quite high in the province, and that obviously makes us very worried that the numbers will continue to grow because people continue to move, people continue to interact. Let's go next. That was Google data. This is now Facebook data that allows us to look at the level of districts. You see there the mobility in the city of Johannesburg, city of Tshwane, Ekurhuleni, and Citibank. If you look at the dark blue curve, there's, as you've seen with the Google data, a slight downtick in mobility, but very small compared to the big picture. And overall mobility is quite high in the province, in all the districts of the province. Let's go next. The hotspot analysis is very important because not only do we look at all the numbers, we have to look at where the numbers are and how they are growing, and are they creating clusters or hotspots. So this is a situation using the IBM viewer of the clusters in the province so far as of the 2nd of June. We currently have 16 hotspots with more than 100 cases, up from 11 the week prior. So we also see the sustained growth in the number of clusters. We have 3 main groups in the city of Tshwane. Most of the clusters right now, hotspots, are in fact in the city of Johannesburg, but we also have a cluster of hotspots in Vereeniging. Can we go next? We provide to the population and policymakers an index that speaks to the severity of these hotspots, how dangerous they are. And if the number is above 20, that means that the hotspot is growing very, very fast and is engulfing neighboring hotspot. That's a very dangerous one. So far, none of them passed that index, but the number of hotspots is growing. Let's go next. Let me give you a couple of examples. This is one of the most active hotspots we've got right now, which is in the Pretoria region, and you also have the number of the cases compared to the epidemiological curve, indicating that there is an uptick in the number of cases attached to that hotspot. Next one is a hotspot in Krugersdorp that shows similar behavior with an acceleration in recent couple of weeks in the number of cases assigned to that hotspot. Next one, please. Now we're going to talk about risk indexes. These indexes basically tell us how serious the situation is. Are we in high risk or medium risk or low risk? So we look at the map of the risk indexes of South Africa, the interactive map there. We basically clearly see that provinces such as the Free State or the Northern Cape or the Northwest are solidly in a third wave. You can clearly see from those curves that you have there. But also provinces like Mpumalanga and Limpopo are also undergoing an increase in the number of cases, and their risk is also approaching medium to high. Let's go next. If we look at the situation in the province, it's very important to look at what happens at the level of districts and sub-districts. What you see there is that Citibank continues to be in the high risk area with some significant acceleration in the risk, but not only Citibank, because of the mobility that I just discussed. People move around, the virus is moving around as well with them, and then what we see is that the numbers are also increasing elsewhere. The risk is increasing across the board, especially in Tshwane and Johannesburg. Let's go next. If we zoom in to the Citibank sub-districts, we see there that Midvaal is experiencing significant acceleration, is solidly in the high-risk area, but also the other two sub-districts, Mfuleni and Lesedi, are also experiencing acceleration, and they are in the high-risk area as well. When you look deeper into the Johannesburg, Tshwane, and Ekurhuleni sub-districts, you can see that some sub-districts are experiencing more acceleration than others, but overall, all the sub-districts and most of the sub-districts are experiencing a growth in the risk index. It is approaching medium to high, pretty much almost across the board for all sub-districts. And I will, in closing, show a snapshot of what our risk index, the overall risk index of the province using artificial intelligence is. That puts all the data together, everything that I showed in perspective. You see there the red curve, which is systematically above the orange curve. This means that we are in an area of risk. We are consistently already for about 2 weeks about the high risk, in the high risk region in Gauteng. Thank you very much.
Okay, thank you very much, Prof. We will now have Mr. Malotana, Lisiba Malotana, the acting head of Department of Health, to speak about what we are doing to ensure that we are all safe as we go through this third wave.
Good morning, Premier. Good morning, MECs, members of the media. While the presentation is being loaded, I'll speak to a certain principles that we've always followed as a province. We've always had and agreed that there are three principles that we work with. Currently, of course, with where we are in the pandemic, it's the speed at which we can vaccinate the number of people against of course, the second part we shall be talking about the management of the resurgence, which is about how do we suppress the infection, and lastly, the management of or reduction of morbidity and mortality. That's the issues about the hospital administration and, of course, people being discharged alive. I will not repeat, I will skip quite a fair amount of slides in the presentation. If we move, these principles are known. The national picture in terms of where with the pandemic is also known. I would want to just to demonstrate in terms of the active cases in the province, the positive, the recoveries and the mortalities that of course we are, as Professor Melado confirmed, we are in the third wave and we are at the peak. In the last 7 days, of course, we've seen the resurgence in numbers, on average over 2,000 daily infections recorded, and that's cause for concern. And of course, that's what will informed National Command Council to adjust the level down, the lockdown levels. If we move to the next slides, it just also breaks down in terms of the active cases and against the recoveries that we have in the province. I think one of the issues we always recommend is that the province has highest number of recoveries with the lowest number of mortality, and something that will remain commendable. We could go to this, of course, the daily infections. Prof made reference to it. What we are demonstrating that in the last week of the 7 days, Of course, we with the 15,291 cases recorded over the 7 days, is quite something alarming. It's something cause for concern. And the pockets that Prof. Melado made references to are cause for concern. If we move, this is, of course, the daily dollar average on daily basis. It just shows you that we are still lower than where we were at the first and the second wave, and we hopefully, with the capacity that we have in the system, that we should the third wave should not be worse than the previous. If we move to the next slide, this is just, of course, the regional breakdown, confirming the total number of cases that we have totally in the province, having 465,000 active cases. Maybe noticeably is that we've surpassed 11,000 in terms of the recorded deaths, but we were always hopefully in terms of the 15,000 7-day average remains a cause for concern for us, and that requires the citizens to be actively informed. That's the low level of details. I will not talk to the Professor Melado graphically demonstrated the pockets of concern. Maybe safe to say, of course, Johannesburg region B, C, D, and E, and Tshwane region 3, 4, and 6, and Ekurhuleni N1 and 2, and parts of Merafong are cause for concern for us, because those are the pockets of the recent pressures in the past 7 to 14 days, and we require that the citizens also pay particular attention and adjust the behavior in those areas. We can move. Here's the data details. Maybe safe to say Gauteng as a province, of course, we contribute 32% of the total number of daily tests that gets done in the country, and that's a reflection of the size of the population and then our participation in terms of the infection. Gauteng remains the highest. The breakdown in terms of the contact tracing, the work that continues to be done there, it's the work that we continue to do, and it's something that's commendable. We are just worried about the case-to-contact ratio that's starting to increase, meaning that, as Prof said, the people are moving, the virus then follows people. We can move. The management of patients, I'll just talk to the principal. Currently, relative to where we are, even compared to the first and the second wave, our hospital admissions remains low. Whilst in the past 7 days, there has been a slight increase in terms of those patients. Most of our patients remain in private health. We are sitting 753 patients in public health services. And compared to the total number of beds that we've created, we remain comfortable that we should not surpass. Maybe the point I should need to make that even in the first and the second wave, we have never passed 3,000 admissions. And we are far away from that as far as content in terms of the patients that we see in the system. If we move, this is just, of course, a demonstration, a graphics a presentation of what Prof demonstrated. This just shows you that our admission and that there were sharp increases. There's a relationship between increase in the infection and the increase in the admission, and that's really what is demonstrated. We can move. Really, this is what I wanted to talk to, and I will not necessarily get into the major detail. What we are saying is that between the first, second, and third wave, the province continuously increased the number of beds that we have in the system. And over and above, and because one of the issues is that, of course, we are aware that we have lost Charlotte Maxeke currently. However, there are beds that have been created in the system. Anglo Ashanti had come in, Bronco Sprayed, the ABTs in Jubilee and Barra will also come into place. And what we are saying is that the total number of bed capacity created in the province assures us of the capacity we have, and we remain confident in terms of how we're going to be managing the third wave as where we are. We can move. The point we are making in summary is literally said that for the first wave, and what I'm trying to demonstrate there, that there's a continuous increase, even with the reduction of the current bed capacity that we've lost, we've created additional capacity more. But also we are advised by public health experts that given that there is a process of course, acquired community immunity and the vaccination rollout, the peak of the third wave should not be as bad as first and second, and that's the principle, and that's also continue to assure us in terms of where we are. Maybe just to deal in summary, given the time limit, without repeating what the Prof said, I just want to confirm that over and above the bed capacity, we have been able to have funding allocated to support the staff. We have 1.85 billion allocated for the staffing, and in that 1.58 billion, We have been able to fill 5,521 posts as at the 1st of July, and all those posts are posts that are now available for us to face and confront the third wave as part of and the breakdown is, of course, the 1.5 billion towards the temporary appointments, and there's money allocated for nursing agencies, 15 million, there's 43 million for data improvement and data management, and of course there's also 44 million that is being directed specifically to hire and employ people for vaccinating project. That the details of the vaccination rollout will then be presented. Maybe in a nutshell, that's where we are as a province, and we maybe just want to ask the citizens of the province to, of course, be cognizant that we are not out of the woods. We are still under pressure. We are where we are with the pandemic, and we will want everybody else to comply with the non-pharmaceutical interventions that are being advocated. Thanks, Chair.
Thank you. That was Lisiba Malotana. I saw in one of the media reports my face was put under Lisiba Malotana. So my name is Thabo Masebe. That is Lisiba Malotana. We now will call Mrs. Nomsa Mupe to come and talk to us about the vaccination rollout program. I'm told that one day they actually introduced her as the MEC. Okay, Ms. Mupe.
Good morning, Premier, and good morning to MECs, my colleagues and members of the media. My presentation today will be very short because it's just an update of where we are since we launched the vaccination program from the 17th of February. And then we moved over to launch phase 2 of the vaccination program on the 17th of May. So I will be focusing mainly on phase 2 of the vaccination program. So in total, since the start of the rollout in phase 2, we received just over 196,000 Pfizer vaccines to vaccinate. So yesterday, we received an additional 71,370 vaccines as part of continuation of the program, and we will be receiving the remainder, which is just above 58,000 vaccines this afternoon, as part of the 133,000 doses we're supposed to receive for this week. And as of the 17th of May, we have administered just over 209,000 vaccines since the start of phase 2 rollout. And of this number, 149,000 are persons that are above the age of 60, and close to 60,000 are healthcare workers. So in total, we have vaccinated 328,000 in Gauteng on the vaccination program. I must emphasize the fact that Gauteng, since the start of the vaccination program, has been leading all other provinces in the number of people that we are vaccinating. We have, at some point, Premier did hear that KZN let us know. Gauteng has always been on the lead. We do our best to get as many people as possible to vaccinate. So we have just above 488,000 that we have registered on the EVDS. This continues to be our biggest challenge, to get people to register on the program. But I also want to reiterate the position that Gauteng has taken, that we do not turn anyone away when they arrive at the vaccination site. Whether they are registered or not, we accept them, we assist them to register, and we vaccinate them. That's the decision we took under the leadership of our Premier, and this has been the case. So this next slide that is flighted here basically just shows where we are when we compare ourselves to other provinces. And as I indicated, we have just done just over 328,120 people since the beginning of the vaccine rollout program. Next slide. So if you disaggregate it, if you want to have a look at how we've fared in terms of vaccinating the healthcare workers, we're doing relatively well. We've done 87% of the total population that we had targeted. Remember when I did the first media briefing, I did indicate that we have a total of 215,101 healthcare workers that we have to vaccinate through this program. We've done relatively well because we've managed so far to cover 87%, and the remainder, which is the 28,000 and odd number, we should be completing it by the end of next week. Next slide. In terms of the people that are over the ages of 60, our total target is just over 1.3 million, and to date, as I said, we vaccinated close to 150,000. And you can see how all the districts have fared. Obviously, Johannesburg will lead because that's where the biggest numbers are, and the private sector is also making a big contribution to the vaccination program. They are sitting at 49,330 people they've vaccinated that are above the age of 60. Next slide. In terms of people that are in old age homes or long-term care facilities, this is an area that we pride ourselves in having pushed and made sure that the people that are most vulnerable are vaccinated. We have got 218 old age homes that we had targeted, and to date we had covered 99 of those, and the population in all the 218 is 26,216 people that live in these facilities, and we've done 17,703, and in the next week we should be completing the 18,830. So the next, I think, three slides will show the vaccination sites per district. I'm sure members of the media don't see this for the first time because we have been publishing them in the various media and communication platforms available to us in Gauteng as well as the National Department of Health. So in summary, the program provides the best chance of reducing new infections, severe illness, hospitalization and death. We urge more residents who are above the age of 60 to register for the vaccination program because the more people we get vaccinated for COVID, the more we'll get closer to the end of the pandemic. We'd also like to thank the general public for their patience and support during the rollout program. Next slide, please. So since the start of the vaccination program, we have seen a steady increase in the uptake of the vaccine. We currently have about 103 sites, with 63 being public and 40 being in the private sector that operate and ramp up the numbers of those people that we vaccinate. We also continue to encourage people to register on the system so that they are vaccinated. And at the same time, we'll ensure that all the sites make adequate plans for walk-ins. As I indicated, we will not turn anyone away from the vaccination sites. And our community workers are really assisting the elderly in their homes and other settings to ensure that they are registered on the system. Also, our call center is also supporting and registering people and directing them to their nearest vaccination sites where possible. This is the hotline, and I think I did present this in the last media briefing, and most of us are aware of it. Next slide. I think I would like to end here. Thank you, Premier. Thank you.
Right. Okay. Thank you, Ms. Mupe. Dr. Maxeke will come and speak to us about what we are doing to manage some of the problems that we're having. As you know, we have a water crisis affecting some of the hospitals, resulting from the work that was done by Rent Water and Joburg Water. But Dr. Maxeke will come and talk to us about what we are doing to manage that situation. He will also update us on where we are with regard to the reopening of the Charlotte Maxeke Johannesburg Academic Hospital.
Thank you, Teach. Good morning, Premier, MECs, colleagues, and members of the media. Let me start with maybe updating in terms of the water challenges that our service platform has experienced over the past 2 weeks. As we all know that we are probably one of the biggest consumers of water, but it also becomes an important requirement for us in the service platform. And that is why it's very important that we then have strategic alliances with our suppliers of water, which does exist. And from time to time, we do meet and then engage in terms of that. But also as and when they also try and improve on the water infrastructure, we are always given priority as facilities. As an example, Isbara is supplied directly by rainwater as a reserve line, but also by a city of Joburg. So as and when the city of Joburg does maintenance, then we are able to. So there is, from a risk mitigation point, there is that we are comfortable that we had really been able to just engage and ensure that we do have those kinds of supplies. Be as it may, when we then receive the water from the municipality, we also have got reservoir tanks that are there so that they can be able to hold when we have. It's the capacity of the tanks, and with also in terms of the increase of the service platform, it can only hold us at some facilities from about 6 hours, and in some facilities 24 hours. So what then it says when we have a water challenge that goes beyond certain hours, then we will be able to then run out of it. But we do have then water tankers that are made available immediately when we've got challenges with it. And this is supplied both by the city of Joburg, but also through our implementing agent, which is infrastructure, which then is able to procure within that. But you can then understand that if you have a reservoir like Helen Joseph of 260,000 liters of water, and the water tank has got 10,000, it means you need to have about at least minimum of 26 of them being able to come and supply and replenish that water. And the consumption in our facilities, the smaller facilities, ranges from about 50,000 liters per day, and at Helen Joseph in particular, it's 750,000 liters, and at Rahima Musa, it's 100,000 liters per day, the consumption. Therefore, you really need to ensure that at least the tanks you've got in terms of that. So having realized that this now is becoming a challenge and affects the services, and also looking at the high rise of our buildings, the department, in conjunction with also the infrastructure and also through EXCO, is really embarking on just ensuring that at least we do have, in terms of enough water tankers that we can have, so that it becomes at least a meaningful backup that is then able to come in when our reservoirs are then running dry, so that then we are able to. Yes, we are also looking at where a law permits, in terms of also having another supply, boreholes. Some of our facilities have got boreholes, but now we're also looking at that and just ensuring that at least we're able to ensure that we keep that supply constant towards the facilities. That's really in the main how we then plan to risk mitigate in terms of just ensuring that this critical supply we are able to. And then as far as Charlotte is then concerned, I will not really go through what's that. I think it's we've shared with the media. I think for me what is critical is then to update where are we, having walked this journey from the 16th of April up until now. We've had serious engagements with the city, just ensuring that the new regulations that have now been applied, that when our facilities were built, it was not applying. We were able to just ensure that Charlotte does comply. We have presented at EXCO a phased-in approach, which is supported, but also we then presented it and requesting the city that they're able to support it, because if we're to go with the regulations, Charlotte will remain closed for a long time. And part of what is then at least we'll be able to quickly bring back is the oncology service. And not all of oncology service, I must also state up front. But we're also then looking at bringing in the other critical support services where the system is having pressure, which is the maternal services. And as we speak, there is a walkabout which is meant to inspect in terms of what we have already presented and submitted for the files for the oncology service. We hope that at least this will then succeed. The facility has always, as per the plan, requested that once there's an approval, they are given 48 hours so that they are able to prepare for resumption of the services. So today the city is visiting the facility so that they are able to then to work about multiple service providers varying from various skills, which then will be your fire engineers, your structural engineers, your architectural, so that you are also able to then do in terms of drawings that is able to give us in terms of the indication of it within that structure. This is a structure where the drawings were submitted, but because there's been improvement and those drawings we're not able to get them, and to a point we are now investing in a newer technology, which is just the 3D scanning of a facility, so that we can then be able to get the drawings afresh. We do drawings afresh, and we are then able to submit them to the city, get also in terms of the evacuation plans being prepared in line with the drawings. The city is really shown that at least if we are then able to, they will then be able to. We must also emphasize that through the intervention and also the leadership that we've got from the Premier, there's cooperation and working together, and all of us really feels that we need to ensure that the facility is opened but in a safe manner. And safety to the city it's different to what us we see as safety. Structurally, the building is very sound. It's just that it's not complying with certain regulations, and that is what that safety is referring to from the city point. Thank you very much.
Thank you very much to all the colleagues who made presentations to update the people of our province about the trajectory and the trends with regard to coronavirus infections in our province, as well as the vaccine rollout to locate the province appropriately relative to the rest of the country, and the resurgence plan. So how are we responding to the trajectory that has been mapped out by our advisory committee of scientists who are saying this is where the hotspots are, how many hotspots are gaining momentum in which parts of the province. And the last presentation is basically about just dealing with what I would characterize as compounding crisis issues that would compound the COVID-19 pandemic, and the crisis issues that would combine the pandemic relate to the fire at Charlotte Maxeke, Johannesburg Academic, and the water cuts that have impacted on several hospitals. So I want to sum it up by saying that you would see from the evidence presented by Professor Bruce Melado that Gauteng province is at least in the third week of the resurgence of the pandemic in our province. So you would remember that on the week that is on the 14th, it was the 14th of May, we already said the numbers we are seeing are of great concern to us, that our province is crossing the threshold of what would define high-risk infections. So over the past 3 weeks, that evidence presented by Professor Melado shows that over the past 3 weeks, we have had sustained increases in the number of infections. The spike is continuing. 1 week it gains faster momentum and slows down just a little bit, sometimes as a result of weekends, and we have been trying to understand why is the infection rate over the weekends lower, and we compare that with testing to see if it is because we are testing fewer people over the weekend, because mobility, as you saw, that mobility during the weekend actually increases instead of slowing down. We are tremendously concerned about the increases in the hospital admissions. So increase in the number of daily cases and weekly average is one concern. The second concern is the increase in the number of hospital admissions. As you would have seen by now, as we speak now, 2,866 patients have been admitted in Gauteng hospitals, both public and private. So what happens with the hospital admissions is a matter of great concern. It tells us the story. What's the difference between 1 week and the next? And what does this do to our capacity? So that presentation done by Mr. Malotani. So as we see more hospital admissions, including the increases in the ICU, those who are in critical care and ICU, it gets us to have to look at the relationship between that and the hotspots and what capacity we have in that area, what plan we should make for the following week. The number of people who have been passing on, those succumbing to COVID-19, that number is also a great concern in our province. So you can see for a week at least, Gauteng, in the number of people, the daily mortalities, Gauteng has been leading there. It's a matter of great concern to us when there are more people who are passing on a daily basis. In fact, in terms of daily, as we speak now, Gauteng accounts for at least half of the daily cases that are reported nationally. Prof. Melado was saying we have reached the 3,000 mark in the so where were we last during the first wave and during the second wave? When we reach the 3,000 mark, we indeed get extremely concerned. It is easy once you reach 3,000 to get to 4,000 in less than a week, to get to 5,000, get to 6,000. We can't forget that we reached 6,500 daily cases during the first wave and 6,900 daily cases during the second wave. Our peak was like that, 6,500 and 6,900. So when you get to 3,000 daily cases, you must be worried about the peak. You must be worried about the momentum. You must be worried also about the pace of actual pandemic itself. But you also have to be worried about the increase in the number of hotspots. Professor Melado also showed us where these hotspots are. So obviously there was a week where we were more concerned. 3 weeks ago we were more concerned that the pandemic is in Sidibeng in the south. 3 weeks ago. 3 weeks later the pandemic is not only in Sidibeng, it's in Johannesburg, it's in Ekurhuleni, it's in Tshwane. So those hotspots have now moved just from Mfuleni, and then they have also moved to parts of the West Rand. 3 weeks ago, the pandemic was literally, the fire was not there in the West Rand. And we were there with the MEC for Health and the MEC for Infrastructure. 3 weeks ago, we were opening the hospital, Anglo Gold, Ashanti. The infection levels in the West Rand were very, very low. And we know how it started. There was a cluster outbreak in a Mohali city, in a locality, Azadville. There was a huge cluster outbreak in the community there. And then the fire caught, moved to Rand West. So now it's Mohali city and Rand West. And that fire is moving to Mirafong. So you've got to understand, 3 weeks ago in Ekurhuleni, we were not worried about any hotspots there. And then we started seeing the hotspot coming in the north, Ekurhuleni North, that's the Tembisa area. 3 weeks ago in Johannesburg, the hotspots were really very small and very limited. Now we can see those hotspots are stretching from the south to the north. They're getting up to the north, region A of Johannesburg, from region G. 3 weeks ago in Tshwane, the hotspot was just a small hotspot, just we were hardly able to see it. Now you can see that 3 weeks later in Tshwane, that hotspot is growing from the city center to Pretoria West to Atteridgeville. And we know the pandemic in Tshwane, always the activity of the mobility, activity, and infection, once it starts that way, it is going to go to the northwestern part of Tshwane. It will get, it's Harankua, Mabopane, Winterveld, and the east, which is the eastern part of Tshwane, which is Mamelodi, will follow. So 2 weeks later, so this is where we are now. 2 weeks later, our sense is that unless certain things happen, we may be at a very different level. We are now, as I say, 3 weeks later, we were at a different level. 2 weeks from now, the pandemic may be at a different level. We reached a peak, as I said, in the first wave, we reached a peak at 6,500 daily cases. During the second wave, we reached a peak at 6,900 cases. We don't know when will we reach the peak, but we must say the tendency, that's from the science, the tendency is that the third wave is slower, but more sustained. It's like long burn, it's a long burn. It's slower, but more sustained. So if that tendency from the evidence, it means that we are going to be into the whole of June, we are going to experience, unless something else happens, including more enforcement and compliance, we will have this sustained increases that's much longer, up to right to the end of June, much longer and more sustained. 1 week, you saw from the presentation of Bruce that the increases are lower week after week, but they are sustained. From 63% in 1 week to 40 in the last week now, over 4 weeks to 40%. That's still too high. Someone may say, oh, well, the infections are lower, are decreasing. No, we can't celebrate that. In 1 week, 40% is still too high in new infections. But if you look at the number of people who we are losing to the pandemic, it's still also a matter of great concern. So from our messages, I think we would like to say to the people of our province, we are in the middle of the third wave. And what happens every week is of great significance about whether the pandemic is gaining more momentum or is slowing down. We are not seeing evidence of compliance, of better compliance. We are not seeing evidence of these messages are not getting out there that the pandemic is everywhere. We're now picking up the reports of infections, including family-level infections. Those reports are coming from almost every part of the province. And it is winter. We are very concerned. It is winter and it's cold. And you know what happens when it is cold? People are not able to go out into the ventilated spaces. And even in the informal settlements, people want to be closer in close space. And those are the conditions where coronavirus thrives. This virus thrives in closed spaces. And when people are more indoors than outdoors. So we are extremely concerned about the coincidence of this cold winter. It's much colder. It's worse when there is inadequate supply of power and electricity. So I want to deposit this again. We are deeply concerned also about, so there's been load shedding. We are deeply concerned about the impact of it in our battle against COVID-19. Water cuts has been a matter of great concern. The water cuts have impacted on our fight against COVID, especially. The water cuts have not only been experienced by our healthcare facilities, but also the communities in Johannesburg. This morning, I spoke to the CEO of Rand Water. And this is just an illustration that the provincial government has been working with the city to do everything to address this issue of water, the water cuts and the inadequate water supply. As I say, for our hospitals, it compounds the problem. Inadequate when the hospitals don't have sufficient water supply in the middle of a pandemic that needs so much water. We say people should wash their hands, but the healthcare system cannot operate without adequate water supply. And this morning I was assured by the CEO of Rand Water that the system breakdown that has happened in Johannesburg has been restored or resolved, and that water. And I asked our team from health, the MECs, people responsible for infrastructure, health infrastructure, I asked them to check if the institutions that were having water problems are reporting that water is returning. Dr. Maxeke is responsible for healthcare infrastructure, and even this morning after my discussion, because our provincial government has really been deeply concerned that in the middle of a pandemic, in particular, healthcare facilities are struggling with water supply. So I have an assurance from the CEO of Rand Water that their system breakdown has been resolved. The system is up and running. It may take a while for water to be restored fully. In our healthcare facilities, we've got reservoirs, but those reservoirs can only cope with water interruptions for a certain period of time. if water interruptions take as long as we have experienced, those reservoirs cannot cope. And I want to state again publicly that this has been a matter of great concern. It has been compounding the increase in the impact of the increase in the pace of the pandemic. That impact has been accelerated by the water crisis. And this matter, our Department of Cooperative Governance, COPTA, led by MEC Maile, will continue to work, and the water problem is not only once. In some areas it has been sustained. There's been sustained water shortages, and the MEC for COCTA and the MEC for Infrastructure Development are going to be supporting the MEC for Health to just make sure that all our healthcare facilities have adequate water supply. We also have experienced the negative impact of the fire at Charlotte Maxeke has not just been on one hospital. Charlotte Maxeke Johannesburg Academic Hospital occupies the apex of Gauteng public health institutions. It's sitting at the top. It offers specialized services, some of which can only be offered at Charlotte Maxeke. Some of the specialized services that are offered, they are not offered anywhere. Others are offered there in conjunction with other tertiary hospitals. So I want to state again today that the Gauteng province cannot afford to have Charlotte Maxeke Academic Hospital closed in the middle of a pandemic that is raging. We cannot afford to have it closed at all. And in the last few weeks, we have been working day in, day out, 7 days a week, with the two MECs here, the MEC for Health and the MEC for Infrastructure Development. We've been working 7 days a week. We arrive at Charlotte Maxeke on a Sunday. We've been working day in, day out to do everything to ensure that that hospital services, the hospital is reopened in a safe manner. But given where the pandemic is, I want to also say that the pace of the pandemic and the impact of the pandemic in other institutions can only be tackled decisively. We can only respond decisively and effectively to where we are in the pandemic with a functioning Charlotte Maxeke Academic Hospital. And the longer it stays closed, there are now clinical risks. So it is no longer about whether that fire door needs to be changed, and then you need a different new standard fire door. Yes, you need it, and it must be ordered, it must be fixed. And whether in another area there's a fire issue or a health and safety issue that has been raised. It has gone beyond issues of occupational health safety to issues now of life and death. So we have been meeting with the unions, we have been meeting with the clinicians, we have also met with the South African Human Rights Commission. We have also met with the Section 27, that's an NGO that's very active in the healthcare sector. And all of us are at one, that the sooner Charlotte Maxeke is reopened, the better for our response to COVID-19, but also for other non-COVID burden of disease. And one of them is cancer. Charlotte Maxeke is the top of the class in providing services, and that is why the good news is that The city of Johannesburg is doing an inspection of oncology block right now. And that's the first block that is ready for reopening. And we did say earlier in the week that we will start with the oncology block, but it will not be enough. It will not be enough because there are patients, not only oncology patients, there are neonatals from Charlotte Maxeke who are at Rahima Musa. Also the other patients, mother to child, a big section of that who are also in the other hospitals. But Charlotte Maxeke also had critical ICUs. It has been in the forefront in the battle against COVID-19, in the treatment, admission and treatment of COVID patients. So the Provincial Government Executive Council met on Tuesday. We had a special Executive Council meeting on Tuesday and took a decision that all the issues that are being dealt with about reopening Charlotte Maxeke Hospital must be escalated, and we must have nothing that stops on the way to the reopening of Charlotte Maxeke Hospital. So we are talking to national government. I had a discussion with the Minister of COGTA, responsible for this national disaster management. We have been discussing with the city of Johannesburg because it is in the city. We have also, MEC Maile has been having the team of local government. We are also exploring whether to declare a disaster, a localized disaster at Charlotte Maxeke itself, so that it gives us an opportunity to use those aspects of the hospitals that are much safer, even if they may not be complying 100%, but the clinicians are saying to us, and that's the general argument coming from the clinicians, that there are parts of the hospital that, given where the pandemic is, should open much more urgently. And we are having specialists, engineers, teams of engineers. There are those that have cleared the structural issues around the building being structurally sound. In other words, the fire did not destroy the whole building. It's only one block. And then we also have the occupational health and safety specialists and the legal team that's advising how quickly can we get to the reopening of the other areas. The pressure is quite severe. The increases we are experiencing in COVID admissions and the other facilities would want Charlotte Maxeke in operation as of yesterday, because they were also referring there some of the more complicated cases. So the impact of water cuts on our health response to COVID-19 has been terrible, and we can't afford water cuts again in our province. But we are not in control of water supply. This has to be made clear. We are not in control. So what we are doing is using disaster management regulations. We are going to complement the supply of water, and I want to really thank the NGO that has just come and provided substantial relief, and they've also done something very, very important by digging the borehole at Rahima Musa. We really, gift of the givers. We really thank them for the intervention. Provincial government, Department of COGTA, which is also responsible for helping us to intervene on water supply, is also looking at the period we are in. June is the most crucial period in the Gauteng province. Just looking at the evidence, if if all these interventions happen later in July, that will be too late. If Charlotte Maxeke reopens much later in July, that will be too late. If we don't get constant supply of water now in the middle of the third wave, when the numbers are increasing and the pressure is building on the system, to get this help later in August, that will be too late. In other words, any other intervention and support that's required to our healthcare system, that includes ensuring that in the budget we have given you, MEC, for more healthcare workers, retaining those posts, bringing in all those. The healthcare system is under pressure now. The healthcare workers are feeling. One group of healthcare workers are doing rollout of the vaccine. They are doing vaccination. Last year, this time, all of them were in the healthcare system. But now, rolling out the vaccine is very, very good. But if you think those healthcare workers busy with the rollout of the vaccine, it means they would have been busy somewhere supporting the system. So they've created some holes. Although they are supporting a very important, so it means even from a human resource point of view, there is more pressure. That's why that money we allocated for ensuring that we can increase, and the beds that we created, MEC Mutara, all the beds we created, whether it's ABT beds or additional hospital beds, everywhere in the province, this is the time we need those beds. They can't be sitting there empty because there is no equipment or there's no staff. Those beds have to be put for very, very good use at this moment. That one is within our control. And I was saying the water issue, the water interruptions, all we can do is to make a temporary arrangement. In the long term, we are also looking at how to boost in every hospital where we have our water reservoirs. What is the plan? And one of the issues is this. So Gift of the Givers has done a borehole in one area. But what we know in Gauteng is that you can't do boreholes in all the areas because of dolomitic land, but also because of acid mine drainage. So there are complications around. So the Department of Infrastructure Development is completing its work on in which hospitals is it possible to do boreholes to help with the water interruptions. But I want to say that there will be facilities where it will not be possible because of the problem of dolomitic land. Otherwise, and acid mine drainage. You remember, this is the mining belt. We are sitting right on the mining belt. Pollution caused by acid mine drainage to our water system is extremely toxic. So I therefore want to conclude by saying that we need every facility in Gauteng, we need every facility to be in full operation. And we need all posts that we have budgeted for to be filled. And we need the people of our province, again, we need their cooperation. You can't respond just by these healthcare interventions. As I said earlier on, it is cold. When it is cold, people tend to be indoors. And that's the time that the virus needs, when it's indoors. When people are indoors. It is winter. We can't do much about the fact that it is winter. But we also want to urge, even when people are indoors, even when your families, continue wearing your masks. Even when it is a difficult life, but it is better to try to keep doing that, to just save and protect each other. Even when you are 2, you are 3 in a household, the moment someone has been, I want to say in Gauteng, the virus is now everywhere. The moment one family member goes to the shops or goes to work, when they come back in the house, they are potentially a carrier of the virus. That's why we have to just leave these extraordinary lives of putting on our masks, even in our homes. Not just when you go to the shop. That's no longer enough. Even children who go to our schools, and the schools must be open. We have reached that point where we can't keep shutting down the schools. Workers must go to work. The economy cannot afford a total shutdown. That's what we want to reassert. But we can do better by working together on all these extraordinary means. I must say, on behalf of our Executive Council, we have been very distressed with the water situation, the impact of the water situation, and the impact of the fire on Charlotte Maxeke, and just what this means in the middle of a pandemic. We will not give up the fight. We want to continue the fight and ensure this province emerges from the third wave, having done everything to contain it. But we must continue to vaccinate. I watch those numbers. MEC knows. I watch the numbers every day about how many people are we vaccinating. Ms. Mupe, last week we increased the number of sites. I want to see that we are increasing the number of sites every week. Of course, it depends on the allocation, the number of doses we receive. So we must vaccinate more. There are elderly people who are better off. The numbers talk for themselves. And the response is really great. You see it. And that's why there can't be any bureaucratic reason not to vaccinate when people are there. We can't refer them to some EVDS system. When they arrive at the vaccination, if the vaccines are there, we must be able to register them and make sure that we can account for them, and we must be able to vaccinate them. But we must also say our teams are doing this registration drive. Our teams have not stopped going to. We need more people on the system, but the system can't be a reason not to vaccinate people. So we are putting people on the system by helping those that may have not been on the system, even those who are on the system who are still waiting for an SMS to be notified. We would like to say to them, check the nearest open site. If you are registered and the SMS has not come, go to the nearest site that is open nearer to you. Let them check for you there. And I want to say, if we have vaccines, they will also be able to vaccinate you because you have registered. So you can't wait for the SMS forever when you have registered. This is the message we are getting. We don't want them to crowd the vaccination sites. We don't want them to do that. But the more vaccination sites we open, we want people to know, elderly people to know that we are there to help them. Check where is your vaccination site, nearer to where you live. And if you qualify 60 years and above, our healthcare workers will help you. And that's what this province is about. We don't want to be bogged down on bureaucratic, administrative, and technical things. Send elderly people up and down because we are using the technology system that may still be improving. And the EVDS system is still improving very, very well. But it may not be an adequate response. And that's why our approach is, elderly people, check their nearest site. If you are registered, definitely, and your nearest site has got vaccines. Whether you have received an SMS or not, we will ensure that you get your jab. Thank you very much.
Thank you, Premier. We'll now take questions. The mic, we'll start with Ndayezo. And I'll just request all of you who will be asking questions, just introduce yourself.
Good afternoon, Premier. It's Ndayezo from Power FM. Two questions from me. With regards to Charlotte Maxeke, you speak about wanting it to be sorted as soon as possible. Any time frames, perhaps, in the next 3 days, weeks, when do you feel that this should be done? And the second one, maybe to you and maybe MEC Mutara, with regards to the pressure on the beds, wouldn't that then be eased even if Charlotte Maxeke remains closed by the fact that you've opened Anglo-Ashanti, which was not in full utilization at the time that we had the second wave, and now you possibly have more beds there? Wouldn't that sort of ease the pressure on the bed capacity in the province? Thanks.
Okay, next one. Yeah.
Yeah, my name is Mangoba Mchunu from ENC. I'm just wanting some clarity with regards to the peak. When exactly are you expecting the peak in terms of the third wave, and what sort of numbers are you sort of expecting when you reach that particular point? And just secondly, in terms of the infections, what are you noticing? What's been the reasons, some of the reasons as to why there's been an increase in numbers of cases in Gauteng? What are some of the reasons that you're seeing on the ground?
Okay.
Good day. My name is Maxeke from the SABC. Premier, you actually mentioned a concern about non-compliance in some of the communities amid this third wave. We are, of course, on level 2 of the lockdown. Are you happy with the restrictions here, or do you really wish to see more stricter rules being put amid this third wave in the province?
Okay, it's Noah Mdlong from Jacaranda FM. My question is directed to Ms. Mope. Ma'am, I just want to know, since the vaccination has been taking place, has there been any wastage of the jabs? How much has been wasted, like if it was not properly administered or if it broke and fell? If you could just give us those numbers, if there has been any wastage of the vaccine since phase 1 and phase 2 has started, and in how much quantities has that wastage taken place?
Okay. Those are the questions. I have one or two that we also got on WhatsApp. I think the first one is from Eyewitness News, from Veronica from Eyewitness News. Joburg water crisis. What are we doing to tackle the city's aged infrastructure that continues to cripple Helen Joseph and Rahima Musa Hospital? And secondly, a comment from the government on having to outsource a service from a non-profit organization to find a lasting solution to the water shortages. I think here they are referring to gift of the givers, so it's not necessarily outsourcing. And thirdly, can we get a realistic timeline on the phased reopening of Charlotte Maxeke Johannesburg Academic Hospital? Earlier this week, the Oncology unit was set to open. Is this still the case? And 4, with one hospital closed in the middle of the third resurgence, what measures has government put in place for COVID-19 patients? 5, and finally, residents' complacency is soaring. Is government considering stricter measures which will apply to certain regions to cap the spread of the infections? Then another question from Media 24, Arisa from Media 24. One, Charlotte Maxeke is still closed. What impact will this have on the treatment of COVID-19 patients? And two, has the PCC asked for stricter regulations for the province? Let me just indicate, Premier and MECs, the questions that we received on WhatsApp were actually sent much earlier before you made your comments. Yes, you dealt with some of them, but you can still emphasize if you believe there's any point that you need to emphasize on. We can then answer. We'll start with MEC Mutara and then the MEC Mukheti. If you want to speak from there, you can, but otherwise you can come.
Morning, and thank you very much. Colleagues, we are, as the Premier indicated, we have completed all the remedial works at the Oncology unit. And maybe just to give some context, the way the hospital was built, the Oncology unit was almost like an addition later on. So it was easier to deal with the compliance matters in the Oncology in terms of being able to develop a fire plan, which are some of the requirements of the municipality. In that fire plan, it is related to evacuation. It's also just related to updating the signage according to the current standards, the National Bureau of South African standards in terms of signage. The hospital, for the bigger part of the hospital, though, was built at a time when we didn't have to, provincial government and even national government didn't have to submit building plans to municipalities. It was actually not the law. And there are various reasons for that. Part of them were security reasons. So if you, for those who are familiar with the building industry, when you build anything, all your plans must be registered with the municipality for approvals. But because of security and other risks, the law was designed in such a way that provincial and national governments didn't have to, or even any government facility didn't have to have registered plans with the municipality, because anybody could access those plans, have details of your building, are able to access it in a way that could bring about security and other related risks. So working with the hospital management and the clinicians, we then agreed that the Oncology unit, of course, because it's a specialized unit, and Charlotte Maxeke is responsible for other specialized services, oncology being one of them, that we would prioritize that and be able to address all the compliance matters that the municipality would request and has requested for us, give that to the hospital, and then allow us to be able to work on all the long lead items and longer term items in the rest of the hospital. The city will do an inspection today on site, and that should be finished. In fact, I'm sure by the time we leave now, the municipality would have conducted the inspections on site of all the works that we have done. And once the go-ahead is given, we'll give it to the hospital, who need 48 hours to be able to make it ready. The 48 hours required by the hospital is also just to be able to do their own deep cleaning, bring the staff back on. We'll have to retrain the staff because there's the amount of work that we've done has considerably given almost a facelift of sorts to the Oncology unit. They will have to be trained on the new evacuation, the new floor plan, how to access the building, etc., etc. So that will be done between today and the end of the weekend, really. So I'm sure by Monday services would be able to be resumed as long as we are satisfied that the staff has been properly trained, they've been taken through the evacuation plan, they've been taken through the new access and egress of the Oncology unit. As it relates to the rest of the hospital, we are working with COCTA, as the Premier has spoken about, just alluded to, in how we can access the hospital while we deal with the occupational health and safety aspects of the hospital, while with it being occupied. So we are just looking at the legalities around that. In terms of what the municipality requires, of course, the municipality would require that the building is 100% compliant, and compliant as in today's regulations and standards. We are still committed to giving the municipality a fully compliant building, but with the understanding that we do need to occupy it because of the services that are required. Maybe just to speak about Anglo Gold Ashanti, so all our hospital additional beds.
All right, we're going to come out of the Gauteng Command Council giving us an...
As well as the Anglo facility itself were put up as additional bed space for COVID. So I think in terms of the types of services that can be provided for at a facility such as the ABT and at a facility such as Anglo would not necessarily be the type of service that is required and the type of service that is being provided at Charlotte currently. So neonatal, the ABT facilities would not necessarily be able to cater for neonatal. The ABT facilities cannot cater for emergencies and theatre operations and that sort of thing. So, what we have done is to reconfigure a lot of hospital space within the hospitals. And working with the different hospitals, they've been able to move or access those services in the other hospitals across the province. But safe to say, I think you'd know that Charlotte is a specialist hospital in many respects, and those services are either not available as broadly across the province, or the availability is already constrained. So, for instance, we're using Dr. George Mukari for one of the services, but these hospitals with specialist services don't only cater for Gauteng residents, they also cater for residents outside of the province and even outside of the country, really. So for us, using the legal framework that is at our disposal, provincial government and EXCO will look to what are the legal tools that we have at our disposal to be able to make sure that we can access the building while dealing with the compliance matters. We are satisfied that our structural engineers have given us a structural report on the entire facility. Safe to say that, as Dr. Maxeke has indicated, structurally Charlotte is sound, except for the block that was affected by the fire. The fire, as we know, got into the parking, and the section that was affected by that in terms of the slab, which has been compromised, is block 3 in the hospital. So even when we occupy, we want to, it will be cordoned off, condemned, for lack of a better word, and the access to or from the block 3 will be denied for the entire time until the structure is rehabilitated. That is the only area of the hospital where the structure has and is compromised. And once SABC has completed the full investigations, we can then get in to deal with the structural resuscitation of block 3. But otherwise, the structural engineers have given us a report which confirms that structurally, in terms of the structure and, if possible, where the fire was did any damages, there's just the one block, and the rest of the hospital structurally is sound, safe and sound for us to occupy. I think once we've finalized those legal requirements and legal tools that are available to provincial government, and it has gone through the necessary processes that it has to, we'll then come back to just explain what we've used and what we've done to be able to access the rest of the hospital. Thank you very much.
Thank you very much, Honorable Premier MEC Mutara, members of the media. Premier, I must say, since Charlotte, myself and MEC Mutara has been working side by side, so she even managed to cover all the questions that I was supposed to have responded to maybe safe to say, maybe to our people of the province, to tell them that I really appreciate the well wishes and the messages, and members of the media, you're really calling and then praying for me, the pastors and the reverends. Just to tell, to reiterate to our people of our province that even if you did get the vaccination, the jab, but you still can contract the virus. So it is so important, Premier, and I don't regret getting the jab. It could have been worse. I think I presented with 1 or 2 symptoms which were very mild. You can just imagine if I didn't vaccinate, what would have happened. But then, thank you very much to people of our province, and I'm just going to reiterate the issue of what the Premier is saying, that it's cold, and then we tend to confine in small spaces. Premier, I must say, after I contracted the disease, at my house, everybody was putting a mask. Even my daughter, the last born, was sleeping with me with a mask on. He said, Mom, I love you, but I don't want to contract the virus. So it is really important. When you go out, you come back, you might have contracted. So it's important that even if we are sitting as a family, we must make sure that we always have our mask on. I'm just going to answer the question, Kamangoba, but already the Premier did indicate Guti, we are in the 3rd wave, even though at this stage we are not at the numbers that we were when we were in the 1st and the 2nd wave. So we are monitoring it very closely, and then we are just cautious to make sure that we try and contain the virus. Thank you very much, Ms. Mupe. I don't know if you want to come and respond on the wastage, because the question was asked even yesterday in our meeting. Thank you very much, Premier.
Thank you, Premier, and thank you to the MECs. Vaccines are a very valuable resource, and we guard them with our lives. As and when we receive them, we make sure that we do not have unnecessary wastage. But safe to say that, yes, there has been wastage, but very, very fewer. I may not have the exact number, but based on the reports, as I write them and read them on a daily basis, it could be less than 20. Very, very, very few. Because the people that draw those vaccines and prepare them for vaccination know that this is very, very important. But however, you do have 1 or 2 wastages as a result of perhaps the dosage not being adequate to jab the person. So in that case, a person would not be vaccinated, and that dose would be regarded as wastage. But I have very, very few of that happening in the province. Thank you.
Yes, Prof. Milado will deal with some of the questions about the numbers and the peak.
Okay, thanks, Premier. So there's been 2 questions in regard to numbers and projections, and there was a question pertaining to when the peak is going to take place and how big it's going to be. So again, as long as there's no sudden societal behavior, we have to understand that societal behavior is a leading cause behind waves, resurgences, increases and decreases. So as long as there's no sudden societal behavior in the province, we should expect the peak in about a month's time. That's what the projections seem to give, a week, give or take. In terms of how big the peak will be, as already the Premier indicated, all the projections and models seem to indicate, given the first numbers, the first 4 weeks of data that we've got, that the peak will be less than the second. But we don't want to make a big fuss about that, because the reality is that the numbers will still be large. As we already indicated, the last 2 days we've reached 3,000 cases in 1 day alone. So clearly these are very big numbers. So whether the peak is somewhat lower than the second wave should not be cause of complacency, because the numbers will still be high and will continue to grow for at least the next 4 weeks, looking at the types of accelerations and the dynamics that the numbers display. In terms of causes of pandemic, we don't think, the community doesn't think that this wave is significantly or drastically different compared to the first or the second. One of the things that we monitor very carefully is social media. What is the level of, that we believe on that basis, of compliance of the population to adherence to social distancing, the awareness that the population has. So what we see is that we haven't seen a drastic change, but we see a decline, a continuous decline in awareness in social media as a function of time. So it's not like the awareness has dropped significantly, but we don't have evidence that awareness has improved. So that clearly is a source of concern, as already the Premier indicated. And also a very important factor here to take into account, we are in level 2. So, and we still have very high mobility. All the sources of data we've got so far indicate that the mobility we have right now is among the highest since the hard lockdown last year, which is, of course, a very big source of concern. So that makes the third wave and the second wave somewhat different. During the second wave, we went to level 3, and now we are on level 2 with the backdrop of significant mobility. So the concerns are always there, that the numbers will still become high, and the mobility will play a major role in sustaining the growth in the number of cases. Thank you.
Well, one of the measures we use to assess the severity of a wave, Mangoba, is how many active cases you have in a given moment. So at the moment, Gauteng has got 17,000 active cases. So I want to be a bit more concrete. Macingwa, ngikhulume kahle. Yabona uprofessor udiplomatic. Mina ngifuna ukuyikhuluma kahle. So it is possible that we could have as many as 80,000 active cases at one given moment in the province. Now, if we don't do all the other things, we could go during this third wave as much as having between 80 and 100,000 active cases. So I'm saying, and I mean active cases, not what was recorded from history. So when you reach that level, you must know, it means the pandemic is raging. It means the fire is everywhere. It means the impact of that, hospitalizations would be severe. The impact of that and the potential mortality rate would be much, much, much higher. And in each case, when we are working on what Mr. Malutani calls the battle plan, when we look at a particular locality and hotspot and see that the infection rate relative to the population in that area is too high, we've got to direct certain measures, including law enforcement. If a certain locality becomes a real source of people are not responding. So at the moment we are saying, please, wear masks And if we see in a particular locality, all indications are that the infection rate is rising, then people are not complying. It means we have to increase other measures. So we have these ward-based war rooms that are there located on the ground. They are like your war troops and the tracking and tracing teams that we've got to unleash in those areas. So, and because we monitor this week by week, there's the weekly average. So 17,000 active cases this week. 3 weeks ago when we did our media briefing together, the three of us in the West End, we had less than 2,000 active cases. That's 3 weeks ago. So next week, think of if by within a week the active cases double, we can reach the 100,000 very, very quickly. And the function of that, it's a combination of what is happening where and in those areas which are the sources of fire. That's what the hotspots are. In those, can we introduce more harsher restrictions? So you asked the question, are you happy with alert level 2? Yes. As a province, at the meeting, the national meeting, in fact, we are amongst the provinces that we said we are in the third wave already. We are amongst the provinces that are in the third wave already. We can't remain at level 1, even though the rest of the country, or the whole country, is not yet at the third wave. At that time, it was not yet. So we are amongst the provinces here. You are saying, are you happy with level 2? We argued for level 2, that to move from level 1 to level 2. But your other side of an unasked question is whether level 2 restrictions are enough. Now looking at the developing pandemic. At the moment, we think that there is a lot of scope to do more, much more, within level 2. A lot of scope includes unleashing our ward-based war rooms, and in some areas where there is just, because we also know, Mantingwana, which localities are hotspots on their own. And let me give you an example. There are areas in the city of Tshwane, CBD, where there are hangouts for students. So we know weekend. So there are a lot of these drinking places. And sometimes this is just events that are organized as a result of it's once off, but others are, they no longer complying. So we can't think of level 3 when we can enforce level 2 restrictions. The good thing with level 2 is that the numbers have been reduced, including the number of people who attend funerals, including the size of gatherings. But the key thing we are saying to our ward-based war rooms, in other words, social mobilization, community leaders, we're calling on them, let's not have funerals that are wild. And some of them are followed by events that people call after tears. So we basically, there's also entertainment hangouts that we know. So our law enforcement teams are also going to be more active as part of level 2. Yeah, so the direct question is, we think level 2 for now is adequate. But depending on what happens, how the dynamic of this pandemic is unfolding, we might find ourselves here saying that maybe we need additional measures. But one of the good things is that alert risk-adjusted strategy adopted by the National Coronavirus Command Council allows that certain districts and certain provinces and certain sub-districts you can introduce. So when the president was briefing us, one of the things was that in area you can introduce more stricter measures where it is necessary. We don't need to lift the nation to level 3 for when we see that a particular locality has become a real hotspot, we can increase. All we have to do is to talk to the National Minister of Cooperative Governance and Traditional Affairs, the Minister of COGTA, to say that in Gauteng, in the following districts or sub-districts, the infections are getting out of control and compliance is completely lacking. We need to introduce, that's the risk level, the risk-adjusted strategy does allow us to do this. But at the moment, yes, level 2 is we are one of the provinces that called for level 2. So we have to do everything to ensure that we avoid reaching the number of active cases being as high as 80 or 100,000. And that's what you call, that's what, when you say the peak, that's what the scientists are saying. Peaking, and the peaking at that level can be avoided just by mobilization of communities. I want to say to you that we should avoid that also so that there's not too much pressure on the healthcare system. Johannesburg water infrastructure inadequacies. I think that's the water infrastructure in the urban landscape of Gauteng province is a matter that we have been dealing with. We actually have a plan. We have adopted a plan. We are working with national government to ensure that the biggest problem in all municipalities is what is called revenue water loss of revenue water lost due to aging infrastructure and constant water cuts due to aging infrastructure. So the maintenance, so that is one of our country's major infrastructure urgent challenges. So it's not something that it can only be tackled by the Gauteng province, but we've got a water plan for the entire province, which we are implementing together with the National Minister of Water and Sanitation. I think that will go a long way. We will do an update next week about which will be the next blocks at Charlotte Maxeke that will be ready for opening. But I want to put it also less diplomatically than what Thabo will put. We want to declare a local state of disaster at Charlotte Maxeke, because declaring a local state of disaster is something we've been discussing, exploring with our legal teams, with the clinicians. Declaring a local state of disaster may enable us not to wait for 3 months before all those issues are fixed. It may enable us as an emergency. COVID-19 is an emergency. As a response, that's what the clinicians have been making this case to us, that the hospital is in a better position open than closed. It is in a better position even from a point of view of its safe keep. It's in a better position open than safe. But the issue is which block, so that we don't overexpose. And I want to say that as the Premier of Gauteng, I've said to myself, we can't go through the whole of June without Charlotte Maxeke. Because how else are all the institutions going to cope? I can't throw a rule book when people are dying. I can't throw a rule book, as I say, about a door that needs to be replaced and it is ordered, but it will only arrive in September. I can't throw a book when people are dying and their lives could be saved because we've got that hospital. It has got some of the best equipment, and that it just technically has compliance issues. I can't throw a rule book at the not just the clinicians, but families who say, you know what, my child was going through this, being treated at the neonatal ICU at Charlotte Maxeke. Now they are located at Rahima Musa, but Rahima Musa doesn't have the same capacity because we can't move all that equipment to other places. So we are reaching a point where we have to make sure we make decisions about life and death. And the Executive Council in this province has said, Premier, let's do everything. That's why we are looking at the points that Thabo emphasized. We are looking at what are the other legal instruments, including disaster, a state of disaster, that will allow us to open parts of the hospital that are able to provide better care, including for COVID, without putting at great risk everybody else. But at the moment, having it closed puts at the risk is much higher in our COVID response. So that point has been made, clinically argued about the impact of not opening it versus fixing whatever needs to be fixed. And those things must be fixed. But fixing them will be part of a plan and part of the, whilst at the same time we've got every country I can imagine, every country. When faced with a war situation we are faced with now, you have to treat more people, admit them in your hospitals. You will even use some of the hospitals that ideally you think should be closed. And Charlotte Maxeke is not one of the hospitals that should be closed. In the assessment done, it's amongst the top-rated hospitals in terms of capacity and the state of the buildings. It's actually, there was a condition assessment done by our infrastructure department. It is in grade 3. It's amongst the top buildings that are in. There are other hospitals that are much older, much older, and which infrastructure is much less than what Charlotte Maxeke is. So if you ask, because you asked that very direct question, I want that hospital. I'm not sleeping, and that's true. Atiko hedera. Zawud, anglali, ematingwan anglali, kahle. I'm not even saying anglali kahle, anglali. When the clinicians tell me what the impact of Charlotte Maxeke is and its closure what its disastrous impact would be, I can't sleep. And I can't sleep until we have found a solution to open. So next week we will give an update. And the day it has, so today they are checking just the oncology section, the city of Johannesburg. The oncology section is so crucial. There are large number of people waiting for their treatment, their cancer treatment. At least once that is sorted and the hospital says now we are occupying the oncology unit, it's one problem. But the big problem of COVID, those COVID wards, and then the neonatal wards and mother to child, where those patients, they are spread all over the province. These other hospitals need those beds to deal with COVID. So I want people to understand that it's not just impacting on the hospital itself. So when you said, but would the beds that you have created not mitigate? You know what? We have created beds, but Charlotte Maxeke had 1,100 beds. So having created beds and then you lose beds, in any battle you can't afford. Especially in the COVID battle, you can't afford to lose your state-of-the-art frontline machinery in that battle. That's what has happened in this battle. So we can afford, and we have been discussing with the city of Johannesburg, the leadership of the city understands that we can't afford Charlotte Maxeke to be closed. We are attending to all the occupational health and safety issues, but we want to fly this aeroplane and fix it whilst it is flying and saving lives. If we can fail to do that, it will be a terrible indictment on us. I'm not going to accept that we should fail and sit there with our consciences and say that we can't occupy the hospital because, as I said to you, there's 2 things that need to be fixed. But the clinicians and people and the structural engineers have said there's no structural damage to the building. And the clinicians have said, we, in our unit, in our block, that's not damaged by the fire. We want to move in there tomorrow because we have a build-up of patients. We can attend them at Steve Biko. Steve Biko is dealing with its own, and currently, all these workers are spread across the province. All the workers of Charlotte Maxeke are spread across them. So most of them are also saying it's just stressful to wake up in the morning, but it is fire. And the police are going to tell us at the end what caused the fire. So it is fire that did that. But our responsibility, I really think our responsibility as a leadership, this leadership of the province's responsibility is to do everything in its power to ensure that that facility returns to service as safely as we possibly can. But you may not have to wait for 100% compliance. This is bad. There's no country that's facing COVID that will wait for those kind of things. Every country will respond and use every resource, every facility they have that can save lives. And we can afford to have that facility out of service at the moment. And we are working. I'm adding, we are working with NGOs. We are working with the unions to address this. But we will not sleep until at least this part of the problem, Charlotte Maxeke, is open. We will not sleep. And I know my colleagues are feeling the same. My colleagues are feeling the same. We will not sleep until we have sorted this out. But we have to go over this third wave as well. And on the third wave, we can't do it alone, even if you sort out Charlotte Maxeke. But if people are just going around, so are we thinking that maybe there should be more restrictions? They can only be localized, really. And localized restrictions in areas. If there is a place that's constantly violating the regulations, they are gathering there. And one of the most difficult things is that hangout places where people hang out to have good time. It's very difficult for them to, I don't know if you have been to a hangout place, and for them to keep the masks on. It's extremely difficult. It's extremely difficult. But they are not closed in terms of level 3. We're just appealing that let them comply. If they don't comply, the police will be there. Some of them will be shut down. That's if we have a locality where people are the situation is just getting out of hand, that locality could be declared that we need to have more restrictions in that area without closing down the whole province, without closing down the economy. And that's really a great... So Arisa, we can't afford to have Charlotte closed. You say its impact, I've really mapped it out clearly. The NGO gift of the givers providing water. I think I dealt with this matter in detail. That water crisis itself And the water crisis is happening in different parts of our water supply interruptions are happening in Sidibeng, next to the Val River. There's lots of water interruptions. And as the Gauteng Provincial Government, all we really have been doing is to work with the municipalities and national government around this plan to have water security in the Gauteng City region. So I want to really conclude by saying that these are extraordinary times, and we will do everything we can in our COVID response. We want to save more lives. That's our fundamental preoccupation. We want to inoculate more people. So that's why we need more vaccines. More and more sites must be opened as we receive more vaccines. But we can't do these things without the support of the people of the province. And all they just have to do is adhere to these measures that are difficult, we must say. So when people talk about fatigue, COVID fatigue, they are not easy. They are not easy for anyone, but they are better. These measures are better than infecting people and then losing more and more people, even in families. So that is really, really our appeal. These masks do save lives. Let me tell you a story. I was with the MEC. When she was wearing her masks, I was wearing my mask. When she got infected, I don't know where, and she doesn't know where. But we were together before she tested positive. The only explanation I have, Prof, I don't have the other scientific evidence, is what saved me is the mask. And it was not only me. Miss Mupe was there, and we were because, and she only picked up symptoms later. And then she said to us, I can't come to the launch of the rollout of the vaccine. I'm not feeling well. But she had her mask on. So these masks do work. In the absence of evidence that they don't work, I say they do work. I have had family members in my family who have tested positive, and they would say to me, because you are a bit fussy with all of us about in the family at home about wearing masks, they come and thank me. When one member of the family tests positive and the rest test negative, they come and thank me that in the house you get in there, I always say, where is your mask? I regard myself as a soldier of the MEC for Health, even in my own family. And it is very difficult. So just wearing masks can help a great deal. We're not asking, we know it's difficult for physical distancing. When people live together in a shack and there are many, to say to them there must be physical distancing doesn't make sense. It is easier, they can do certain things much easier than others. And masking is one of those that really save lives. Thank you. I think we are done. Thank you very much. I think we answered all the questions.
All right, thank you very much. We've come to the end of the briefing.
Yes. Yeah, then at least.
What is OAG?
That's what they want next. Yes. But what?
And the assessment. The assessment.
Yes. So remember the structural assessment. So that even
Can we get to the law? Yes, so they also need evidence of each.